everybody. This is Nicole Harris-Roberts with VYNYL, and today I am joined by Priya Padmanabhan. She's a senior product manager at Walmart Health, and today she's going to talk about why product solutions fail and share a couple of case studies from her extensive experience in the health tech world. Priya, welcome to the program. Thanks so much for joining us today.
Thank you so much, Nicole, and thank you all for listening in today. I am really excited to be here and wanted to start off by sharing my thoughts around why product solutions fail and some of the challenges and a couple of case studies. And what I did as a product manager to identify and solve a problem. Why do product solutions fail? Customers are unhappy. Customer loyalty is critical to the survival of any business. If your customers suddenly find good reasons to start visiting your competitors, maybe it's because they weren't satisfied with your product in the first place, or the type of service that they received has been very unsatisfactory. They've either told you about the problems they were having, or they just stopped coming because the problems they were never addressed. Start listening to your customers and solve for their needs and expectations. Poor market fit. This usually happens because we focus more on technology solutions than on the problem space itself. Too much money these days are spent on technologies, as we often forget to get customer feedback. We need to start questioning about the key problems that are in the market and need solutions. What market segments are much suited for the technology? Or sometimes, what are you trying to investigate as a technology concept for your product? Any given time, an idea might be genius, but an execution can be crappy. We don't want to be there. Time to market is key. Shorter time to market is well worth your time and money. This always gives you a competitive advantage, chance to react faster when the market changes, and always be ahead of your competitors. I think problem development or product development, is experience driven. With a great technical proficiency team and precise communications and able to collaborate, get insights on the demand, time to market can be a lot faster and much more efficient. Finally, not the least, sales and marketing team efficiency. Why is your product not selling? Is your market research being very inadequate? No matter how great your idea is, you really need to understand whether the product stands a chance to exist. Is it really solving the user problems? Go for a quick prototype. Get a beta version out there and to capture all the loopholes to give you feedback for improvement. If market research is inadequate either way, you fail to capture the right insights of your product, the product is led to fail. Or there is lack of awareness between the customers. Products cannot be sold if the users don't know the value of the product. If the value is not communicated, the features and benefits are not communicated of your product to the targeted audience, how do you expect the product to be bought? Let's say the customers are buying the product, but the sales volume is very low. It could be for the reason that customers do not understand the product or how to use it, or they don't perceive the value you wanted them to perceive. Timing is key. Launching early and launching later has its own downsides. Launching early product, customers don't know your product very well. In the latter case, you're already ahead of a very stiff competition. Now, let's dive into what is a PM role in the health tech. What are some HIPAA challenges that a product could potentially face? Lack of ongoing employee training, failing to revisit business agreements, failing to update notices of privacy practices, restrictions to your disclosures, lack of regular audits. All these can eventually expose your patient data and end up with a breach of your patient data, which is the PHI and PII, which is HIPAA regulated. So we obviously wanted to mitigate by keeping all these in mind. Whenever you launch a product, be sure to consult with your legal partners. All product managers are not legally sound in their areas, but it's good to touch base with them and collaborate with them closely ahead of the game when you're thinking about the product, understand the legal repercussions of those products, and then take a deeper dive into your execution. PM's role in health tech. there are three major areas that I focus for my role in health tech to be successful. One is the users, market, and the technology. When I talk about users, I really need to understand who my users are, what are my users' needs and expectations. If I need to do a focus group to get the user's sentiments ahead of time before I take a deep dive into executing the product, so be it. And then what are the common themes from the user's needs and expectations? Because all of your scope cannot go into one launch. So it'll help you to understand the high-level themes to come up with an MVP, and then you can iterate on the product based on its performance. Then comes the market. When you're talking market, we're talking about whether your product is going to cater an enterprise or the direct to customers. Then comes the technology. What solutions, how are you going to solution for these products? That's where your engineering partners and the organization infrastructure, everything comes into play. Let's spend a little bit more time on this. Interoperability is accessing multiple services at one point, which means as emerging technologies transform from health and care, there is a need to explore how to create the right data environment for connected health ecosystem. Data at the end of the day is not just for one system when you're dealing with healthcare. As the focus of healthcare systems moves towards supporting wellness, anytime, anywhere care, and an open platform environment is very much required to connect, share data at scale within the enterprises and the systems. Regulations. Understand all the different regulations of US healthcare. It could be anywhere from Medicare, Medicaid, Health Insurance Portability and Accountability Act, which is the HIPAA, Healthcare Quality Improvement Act, which is HCQIA. Integrations. Identify what integrations your product could use to make it easy on the users. Quality. What are the current processes in place that are identifying that are in place, so you identify areas to improve the quality of your product. So let's quickly dive into a couple of case studies that I promised that I would share. The first one is a patient onboarding. Any product or a feature that you're working on, it's always good to understand the underlying problem that you're trying to solve. Here, David is a patient and Esther is a medical staff. These are my two users I'm solving for. But solving for what? The business problem. The business problem here is mobile app adoption is taking a hit. Fallout rates are high. Poor app store reviews. These are the three areas I'm focusing for my business. So for this use case, David is asked to use a wearable to quit smoking. Then the registered nurse hands over a device to David. Then David is excited. He downloads because he's already enrolled in the program. He thinks that he's enrolled in the program. David is not able to log in because his device that is handed over to him has never been activated. He was asked to register first, which he did not expect when he tried to log in. Now on the other side, the user, medical staff, who's Esther. Esther says patients like David many a day. She hands over multiple devices to many patients a day. Sometimes she forgets to activate, or sometimes she collects all those tasks towards the end of the day or even few days for her to activate those devices. She is very well aware that patients cannot log in without the device being activated or registered. Next task for me as a product is, who are my users specifically, and what are their needs, and what are the problem or the product considerations I'm making to solve their needs. So in this particular use case, the patient, who is David, wants a healthier lifestyle and behavioral change. But the product consideration is like David, there are many users at different age levels. So the UI has to be a lot simpler, very intuitive, and they need to be notified and for them to be motivated. On the other hand, the medical staff, shorter workflow, increasing efficiency of their work, and they provide a great value to their patients and also eventually the physician where they work. for which they need required training, fewer steps for them to understand because they already have their ongoing work, and of course, reduced or no errors. On the other hand, physicians, they all fold into physicians because ultimately the physicians, it's lower cost, very high outcome. It has to be easier for them to use the platform that we provide, and the insights that they provide, the data should be super accurate. And then their product considerations are, it should meet all the regulations and the clinical evidence, and the product should perform seamlessly. With all this kept in mind, as a PM, what I did was to first understand and gather, is this a normal behavior on the app today? Collect the facts. Always it's good to collect the current facts and then come up with a delta so you clearly have a vision towards how you're improving the product or the process. When does the situation occur? Is it more occurring on the app, or is it more occurring after in the clinics? And then assess your constraints. Why is it designed this way? Is there a technical debt to it? What is the rationale? If I need to change this process or the product, what all should I be considering if I were to redesign this? Compare existing versus new design against the user value. That's very key, right? If I'm changing something, what value does it offer to the user? Is it making the experience worse, or is it making the experience seamless for them? So it's fewer clicks, fewer frustration, or fewer friction. Gather requirements. Okay, now I have a design process in place. What do I do with it? Should I change any process, or should I change any product? Or what are the edge case scenario that I need to keep in mind? Once I have all of these ironed out, then I have a plan in place that I would socialize with my stakeholders. And I define clear product metrics. What is my objective? What are the key results that I wanted to achieve out of those objectives? What is my plan to measure success? How am I going to collaborate continuously until I launch? Now the solution for this product. Patient gets a text in an email with a pen. Then patient launches the app. Patient agrees to the updated policies, if any. Then patient enters the PIN that they received via the text and email. Two things can happen. You can see that the patients are not registered, or the patient data has been mismatched. Both of it can drive towards a support ticket. The support ticket can already have, it's a process that could already been there, or a support ticket process is not there. So there comes the process that you need to establish. And then within the support ticket, who are they calling? Are they calling the physicians, or are they calling the call center? And then either way, the issue can be addressed automatically, the issue can be addressed manually, or eventually the data is never found, they have to start it all over. Right? So for this plan, what are the product improvements, or where are we innovating, and what is the process improvement is what I was able to gather when I was gathering the facts and assessing my constraints. Let's dive into the next case study that I wanted to present here, patient-physician communication. I'm pretty sure most of you all in the audience can resonate to this use case very well. What is the problem that we are facing today? Doctors' offices were not able to triage patients digitally prior to the arrival whenever appropriate. Meaning, patients and physicians end up spending more time talking about the reason for the visit for the patients, whether it's pre-arrival of the patient at the facility or the post-arrival of the patient at the facility. Patients perceive that they're not being heard. They had to repeat their conditions many a times and also fill a paperwork at the facility. Doctors have no reference or context about patients' conditions when they are ready to meet the patients. What are the business goals we're trying to solve here? Increase digital self-service, increase digital satisfaction, and faster time to care to patients. The current user journey for Smith, let's take a persona Smith. Smith is unwell. He calls a doctor's office to make an appointment. He listens to the options and he presses force. And then look, he is connected to a receptionist where the receptionist is asking what's the problem, and he explains his symptoms. Receptionist says that XYZ time is available and Smith's get an appointment at 3 o'clock. Then he arrives at the facility and goes to the receptionist, hands over his ID, fills a form with the insurance information, writes down the reason for a visit, gives the form back. He's waiting at the facility. Nurse calls him back. Nurse asks him, what is your reason for visit? Doctor comes. Doctor asks the same question. What is your reason for visit? Smith is then finally examined. Smith has to go through 4 or 5 times, iterating on, or not even iterating, calling out why he is there to meet the doctor. How can we enhance this experience and make it much more seamless for them? For this, Smith is in so much pain, he wants to see a doctor. Then he calls the office for an appointment. He selects the appointment option. Within the message, he understands and learns that there is an online appointment scheduling available for him. But he tends to stay on the call anyway to talk to the doctor or to the nurse to get an appointment. Then the receptionist picks up the phone, the medical staff. She asks about the symptoms from him. She types in and puts everything in the system. It's all uploaded to the cloud. And then she wants Smith that he's going to receive a text message to confirm his appointment. He gets a text. He follows the link. He sees that his symptoms are already in the system for him. All he has to do is update the symptoms if at all things have worsened for him since he spoke to the medical staff. And then the confirmation screen, when he confirms, he is given a reminder 2 hours. He was told that he would get a reminder 2 hours prior to his appointment. And then he receives the reminders and get a link to check in. The check-in process is so seamless that he's checked in and also paid for his co-payment, if any. And then he arrives at the facility, and then nurse calls him back, checks his vitals, updates the system. Doctor comes in, sees the notes from views the notes from the system for Smith. And then Smith is on his way to get his treatment, and off he goes with his prescriptions and other information already in the system before he gets home post-treatment. So that is a seamless. So Smith is coming here, seeing the doctor is what we see, but the key is how seamless can we take that experience for Smith, the end-to-end, from the time he calls for an appointment to the time that he leaves the facility after seeing the doctor. So after knowing this problem, we quickly drove this to a wireframe, and then we tested in front of our users for an appointment confirmation. And then once the way for him to get notifications, whether a text, call, or email, and then confirm his personal information, updating his symptoms if there has been any update, and then finally a confirmation so he can add that invite to his calendar too. We put this in front of our users to understand whether this process even is going to wow them rather than filling a form at the facility. How redundant are they with it telling their symptoms multiple times at the facility to the nurse, to the receptionist, or to the doctor? How consistent the communication can go across the patient, nurses, and the doctors, how easy it is. And apply the learnings and takeaways from the prototype testing that we were going to do, we did to improve the digital experience. And that concludes my presentation, and I'm open for any Q&A.
Thank you so much, Priya. I have a couple of prepared questions, but I also just want to say up front that couple takeaways from me, in that experience with Smith, he wanted to stay on the phone, right? But he sometimes a digital experience can enhance their journey, but also sometimes people just want to talk to a human. And so giving that option available to people is still important, right? Now more than ever, maybe, because people are kind of wanting to connect even more. My first question for you is, through all of this, what were some of the biggest challenges that you faced? You mentioned all the different stakeholders that were included here. You mentioned data many times. What were some of the other challenges you faced as a product manager here? And can you tell us a little bit more about how you solve for those?
That's a good question, because there is never a dull moment for a product manager. There are a lot of challenges that we face, apart from the actual work. Like for development meetings, we do a lot of industry and market research, manage our backlogs. We have sprint planning sessions, got to be ready for grooming, the stories, product demos, talking to customers, training the customer service teams, many parallel tasks. The main challenge, one of the biggest challenge I should say that I faced, because my strength has been working on the mobile apps so far for healthcare companies. What I faced is, unlike web, mobile experience should be to the point. And it has to be super precise since it has limitations to the screen sizes. Responsibility to engage with the users within the limited time and attention is key for us. So we'll have to go hand in hand with our UX partners and completely understand their journey. So we are succinctly giving that information on the 5-inch screen, but still keeping them engaged, right? So that's been, so since I have this big task in front of me, I always have to be ruthless on the features and prioritizing them and what content goes in and what onboarding details I'm presenting on the UI. So all of those goes in, and then I make informed decisions based on the data, of course, because without real-time data, I cannot make these informed decisions and update my roadmaps as well. So those have been really challenging because when you actually present the roadmaps to your stakeholders, there are going to be different opinions coming your way. Why is this way? Why do you have to do this feature? Why are you launching it then? So there are a lot of questions and options that comes through you when you have already brainstormed and put it in your roadmap and you're presenting. Now you'll have to back your presentation with data, which is not just the clicks and views, but also the real time, the why, where the industry research and the market research that I've done will definitely come in handy.
So you talked a little bit about product improvements versus process improvements in that workflow, your journey you were showing earlier. Can you give us an example of a process improvement that ultimately led to a product improvement, or the other way around?
Definitely. It all boils down to the action plan strategy for your organization or a facility if you're dealing with hospitals. Sometimes it's a combination of both. You might be dealing with the organization process improvement, or it's more organization and combination of both hospitals and organization. What I do is organize the action plan for any feature or product that I'm working on. Example for the process improvement that I can think of is with my first use case where a device has been activated and there is a support ticket that is opened, and then how the person gets reconciled for that issue, right? Or the user reconciled with that issue. In my action plan strategy, I normally include the areas I want to focus on for improvement. That will help me to map and tie those back to the product goals that I'm working on. And then what initiatives am I going to implement and what actions should I be taking to implement that? Who and what will be impacted? Meaning, are the engineering teams impacted? Is there a legal process there? So all these have to be understood upfront before you go deep into execution. Otherwise, these are all surprises and hiccups when you're in execution to handle these. And identifying the possible barriers and how to overcome. So example would be when you have a ticket that you want to solve for, support ticket, do you really have a customer support team, right? If you don't have a customer support team, what happens to those issues that users are complaining about? Who is going to handle that? What is the plan in place? So all those should be all baked into this action plan strategy that I normally have. So you kind of tend to ask those questions around what if, right? It's very important. What if questions are super vital. So you're at least, whether you're solving for the problem or not, at least you're asking the right questions. So your partners are also thinking along those lines to help you with the right execution of the product.
What if, for example, you get lots of people asking for support and you don't have a process for that, right? I've been in that situation, and on the flip side, as a product, maybe it's great to have an easy, contact support button, but what happens when the person contacts, maybe you'll get an avalanche. Are you prepared for that? Those are all relevant questions.
And who are you and what is your user base? And if you have thousands and millions of users on your app, and if you don't have a proper customer support team to support them with their questions, then your product ratings are definitely going to go down.
Right. Because the supporting process is not there.
Correct.
Yeah, that's a great point. Can you tell us about some of the technologies you were working with in one or both of these case studies, and to what extent, every product person has to deal with the trade-offs, and some of those are constraints with the technology?
I think I see this in three different segments. One is technology readiness for any product. The other one is integrations. The other can be user adoption. When I say technology readiness, it reminds me of a product that I worked at Kaiser few years back, where we were trying to pilot a product called Wayfinder for a Southern California hospital, because all of the hospitals in Southern California, Kaiser facilities look alike.
Yes.
When patients arrive, they are so lost and they are constantly late to their appointments because every single building is the same, right? So we started to pilot a product called Wayfinder, and that could precisely define and help users check in based on the geo-fenced areas or locations. So it was, we were thinking about it when we were doing the check-in process with QR codes that we introduced a few years back, for the appointments that the users have. And then comes the integrations, right? When we are trying to do beacon integrations at the facility, we had a lot of issues with our vendors. We couldn't get the bugs reconciled in a timely fashion with them. We couldn't get onto their roadmaps, or it was a constant push and pull with them. And eventually we were not able to give that seamless experience to the user at all. Then comes the adoption. Okay, now the technology, you're ready, integrations, you're great, and then the user adoption. When you actually do the demos to the users, it'll actually show the product managers how they've adopted the product. Example would be, in certain cases, adoption can be high. Certain cases, the adoption can be more or less normal, because let me think of an example. Symptom checker. Symptom checker is one of the angles that I can think of immediately, where users want to get immediate response once they are put in their symptoms, but you obviously as a product doesn't want to steer them towards inaccurate data.
Right.
What is the solution or the technology you're going to use for it? Are you using AI or anything else? So those are the questions that you need to ask your partners, yourself, when you're designing for a product, and which is the right one for your organization. So you are ultimately providing a seamless, great user experience to your users.
Thank you so much, Priya, for your advice and the great tips you offered today. If you were going to leave our audience today with one last tip or learning from your experience, what would that be?
Ultimately, what I want to leave you all with is, it is much better to invest more time in upstream of the process to learn more about the problem, understanding the reasons and facts about the users, then move on to a solution. Always ask the right questions, collaborate closely with your stakeholders, leverage data to help you inform decisions, identify your strategic and tactical risks and trade-offs. Most importantly, listen to your users. I'm more user-centric. There is no right or wrong way of doing product management as long as it helps achieve your product goals. I really appreciate you all listening to me and letting me share my thoughts and my learnings with you all.
And thank you so much for joining us, Priya. It's been a pleasure catching up with you.